bread goes like this. So
after this photo, we are going to have another photo between the CEO and I, the Excellency the Governor, and the gun for the. Subsequently launch the document, the dummy. To begin our voting, Trying to ask for the markers so that they sign for the dummy. And then we're going to hold the dummy for a photo.
Very good, all right. We hold this thing, shall we?
Nafikiri tupige makofi. Can I guide us the media people please guide us so that the photo is the best we can have.
Look here, look here. You can smile.
Yes. The main photographers are the one with Afro. The one with Afro. I'll ask the president and I.
We can be over here.
Mother kindly join. Department of Planning, Finance and Planning, the Office of the First Lady, the Government Department of Health Services.
This issue of nutrition, particularly for children under 2 years, also under 5 years, adolescent girls and mothers, is a very, very serious issue. Because when children are not well provided for in terms of nutrition, they get stunted, they get malnourished, they don't do well in school, they have a bad start in life, and we waste people. In Kenya, we are talking about a figure of 1.8 million people who get stunted, particularly children. And the future of those children is jeopardized. And therefore, when we partner with the Nutrition International, and they invest money because they get money, for example, from Canada, they invest money to help the people of Kenya. This is really a huge thing. And that is why we are very happy that they're working with 16 counties, although 4 are kind of ahead. And we have, through a process with other stakeholders, developed a nutrition action plan. And now we are at the phase where we need to implement that. And of course, we work with the national government because that is necessary in terms of actualizing SDG number 2 on food security, no hunger, and proper nutrition. Our constitution is very eloquent about everybody has a right to nutrition. So for us, this is a great day where we are also working with community health volunteers, because it's up to them. They are part of the last mile in terms of providing nutrition education, helping children, helping mothers, helping all of us to make sure that there is good nutrition for our people. And we are clear in our mind that both a father and a mother must participate together to help achieve proper nutrition within the homestead, within our communities. And so I'm calling upon our men, I'm challenging our men. It is not good to say that nutrition is just something that the mother will handle, or even visits to the hospital. When a mother is pregnant, a woman is pregnant, we have to collaborate. We have to be going together to those visits. We have to think about the mother having the baby in the hospital, to think together about what is nutritious food. These are things that when we work together, then we achieve results. And I would also like to appreciate the First Ladies, because through the association, the county First Ladies, and their chair, their trustee, their patron is the National First Lady. They are also working on many issues of cancer, of nutrition, of keeping girls in school. So again, it is this collaboration. When all of us work together, we achieve a good result.
Nutrition International has been working in Kenya since 2007, and we have MOUs with counties, about 10 counties since 2016. The focus of our interventions is on prevention of malnutrition rather than treatment of malnutrition. And we would like to create health at the household level. We don't want to sit at the health facility, wait for people to be sick or undernourished and treat them from there. And that is why county governments are at the center of our engagements. We also support community health workers with capacity development for them to have the right messages, for them to teach mothers what to do. And it is very important for the first 1,000 days of life, because if we miss the first 1,000 days of life, then we miss the window of opportunity to address this issue in a lifelong way. We have about 24% of our children stunted, and when you look at those percentages, it seems a small percentage, but the absolute numbers are quite many. We have 1.8 million children stunted, and we also have about 700,000 children wasted. So in Kenya is among the 7 countries in the world that are classified to have all forms of malnutrition existing. So we have children who are not well nourished, but we also have children who have micronutrient deficiencies, and at the same time we have a high occurrence of overweight and obesity. But in Makueni County, we also have women of reproductive age who are underweight or are not feeding properly, and that's about 1 in 10 women, 10% of the women here. So in many occasions, a stunted child and an obese mother coexisting in the same household. And what that means is that we are not eating the right kinds of foods. So we focus particularly on staple food crops like ugali. Ugali is too heavy and does not have all the kinds of nutrients required. The same ugali is fed by the mother in large quantities, but is also given to a child whose stomach is so small in quantities that will not provide the child with the right nutrients. And so we end up with an undernourished mother and an undernourished child and an obese mother, which are the different forms of malnutrition we are talking about.
The emergency of malnutrition in Kenya and around the world. And we appreciate that the government of Kenya is taking steps to raise the profile of this in the big 4 priorities. There is food security and nutrition. And we also are happy to be here today in Makueni launching the County Nutrition Action Plan, because that is where the rubber meets the road. The Sustainable Development Goals will only be achieved through local action, and I have been delighted to witness the leadership of the Governor of Makueni and his team in driving the County Nutrition Action Plan forward. That is why Nutrition International is here, standing shoulder to shoulder and supporting this leadership. Our challenge now is, how do you build on this leadership so it can spread throughout all of Kenya? Thank you.
So probably how is NI coming into the implementation of this plan in Makueni?
So Nutrition International has been supporting 16 counties in Kenya. Among those, there are 4 fast-moving counties, and Makueni is one of those, in order to develop the plans. So we are providing technical support and also financial support to the counties. And we are here in the afternoon discussing with the governor how we can scale up both support from our side and support from the county side for the plan.